All right, so here we are with Jill Davis. Jill, thank you so much for joining me for episode 100, and thank you for being a part of the podcast. I had an awesome conversation with you. I can't remember which episode it was. It was like 10 or 15 ago, a few months back. And that one it really resonated with me because I think that it was just a testament of like the way in which I think audiology is trending and some of the new exciting avenues and opportunities that are starting to kind of manifest. And I know in that one, we talked a lot about like cognitive screenings, but wanted to bring you on as part of episode 100 to just kind of get a sense from you of like what's top of mind, what's interesting to you, what's on your radar, just kind of in general, what's going through Jill Davis's head right now as it relates to this field of audiology.
Well, first of all, congratulations on 100, and I
Thank
can't wait
you.
for the next 100. Thanks
Thank you
for
so
having
much.
me.
Appreciate it.
Well, there's a shift happening in audiology. Can you feel it? Like there's definitely this change going from the device-driven retail dispensing model into the service-oriented medical audiology, and that's what I'm most excited about. I think it took over the counter to kind of give us the kick to look at the value that we're bringing to our patients, and we're implementing more services. So private practice can do cochlear implants, we can do tinnitus testing treatments, we're doing auditory training, auditory processing, like all of the other things that we've been trained to do and to practice to the top of our license. That's what's going to separate us and put us into that kind of medical community. And that's what I'm most excited about. So we are working right now to create best practices for referrals with a neurologist, behavior neurologist, primary care doctor, because audiologists are going to be in the front lines. So we're going to have a seat at the table with those other medical communities. And, we need to know best practices of how to work with these patients because they're going through a lot, and it's up to us to kind of identify and send them the right place. And so that's what we're working on right now. It's really exciting.
Yeah, I love that. And I agree with you. I think that there's you can feel it. It's like palpable. It feels like we're in like a little bit of a renaissance in audiology right now. I mean, I've only been in this industry for like 6 years, but it definitely feels like whether it's OTC or just maybe like this underlying frustration of like the status quo. And it seems like there's a pretty seismic shift happening. And it's interesting because it's not just like in one like specific direction. It's kind of like you said, kind of more of this like broad movement more toward medical. And I think that it's super interesting, like as I've learned through the podcast, through osmosis, learning from people like you, of like as time's gone on, I've realized that it's much bigger than just a handful of different things. Like it's so many different, it's just like rethinking everything. Like it's like how the patient interaction, and this is something that we talked a lot about on the last time we talked, was like just really getting to the root of why they're in there the first place and not making assumptions based on a handful of clues that you can gather from a pure tone audiometry test. I just am so excited by this because I think, to your point, it really elevates the audiologist, I think, in some new exciting directions and provides, like you said, kind of like that seat at the table. And it's cool to hear that like neurology specifically is something I keep hearing more and more. And like, again, that's part of this shift where even like a year or two ago, I don't think I ever really heard anyone mention neurology in the same breath as audiology. And now I hear it more and more. And it makes a lot of sense that these are kind of like the tertiary, adjacent medical fields that we're working closer with, which I think is just going to lead to some really, really exciting opportunities. But to what you were saying is like, one of the first things you got to do is kind of establish that connection. So I think it's really neat. Can you build a little bit more on like what this referral network looks like, how it works? And I'm just curious to learn more about this.
Yeah, it's it's not going to be hard to change what we're already doing. It's asking just a few more questions with our patients. We're already talking with them, getting the history, like asking a little bit more about what else is going on with them is going to open the door to get to communicate with the other physicians about diabetes, hypertension, polypharmacy, risk of falls, all of this other, the cancer treatments, things that our patients are going through. We need to start thinking that the ears are just one piece of the puzzle, just one small part of the equation. And in our world, it's the biggest piece, but our patients are going through a whole lot of other things as well. There's comorbidities involved. And when we can just ask those questions, that gets the conversation started with those physicians. And so, hopefully we can get this MASA going through where we have direct access to our Medicare patients. We get that practitioner status because our patients are trying to come to us, and we are going to be the ones that can start asking a few more questions. And once we have a little bit more information, we know, do we get primary care involved? Do we get cardiology involved? Do we get neurology involved? And so what we're working with right now, because primary cares are a little too busy to implement a whole lot of preventative stuff, we're going to bring to the table what we can provide and show them, the screenings that we're doing and what we're looking for. And that way they can tell us next steps to neurology or to them, and just kind of creating this triangle of trust of who gets the patient after the audiologist identifies some of these comorbidities. And so it's going to be something we get to train primary care, we get to train neurology. And so it'll be exciting. We're doing a beta in Austin to start, and this might be like a national initiative just to kind of show people how easy it could be to just ask a few more questions and get the patient taken care of a lot sooner than later.
I really like what you said about the physician's pretty busy, and it almost seems it's like serendipitous that, kind of like part of this macro narrative of what's happening in this industry right now is this, the writing seems to be on the wall that like maybe some of the time that was previously allocated around the programming and the fitting of a hearing aid is going to kind of diminish. So the question is like, well, what do you do with that time? And it's kind of fortuitous that it's like, you have some of these new things that are presenting themselves where audiology makes a lot of sense because of the bandwidth, and it's sort of naturally like conducive to the conversations that are already being had, where you can do things like those cognitive screenings, but also a lot of the follow-up questions and gathering that information. And so again, like that's so exciting in my opinion, is that it allows for you to then build inroads with all these other medical professionals. And I think that like, that's where you're going to just see kind of like a flywheel effect where just like referrals lead to more business, leads to more word of mouth marketing. And it's like a really positive effect that seems to be kind of like bubbling up right now.
Wow, it's so exciting. And yes, we keep talking about adding value and showing the patient our worth and, doing the extra step to show the value that we bring to programming devices and all of that. And what I'm finding is that cognitive screening piece tells you kind of what you're doing with the patient as far as their ears are concerned. And so you don't have to go into as much detail with them of what you're doing and why you're doing it, because based on evidence, you kind of know best practices to fit them. So you can spend that time, like you said, it opens up some of the time to talk about other things. So where we want the patient to talk to their friends and their doctors about how we were different than Costco and we were different than, someone down the street because we added value. Well, they are, because they're saying she asked about a concussion that I had. She was curious about the list of medications that I was on. She really looked at me as a whole and not just focused on this device and how I was programming it. And so I think that's also a way that we separate ourselves, is that holistic picture that we're bringing.
Couldn't agree more with that. I think that that's so exciting, and I just think that there's a lot more like sustainability and longevity going in that direction than the commoditization and that's seemingly kind of underway right now with the devices themselves. So it's like, it doesn't mean that you as a private practitioner or something like that like the opportunity to dispense and sell hearing aids is going to go away. It's just, to your point, you have to figure out a way that is tangibly different than what all of these other new avenues of distribution are. And I think that, you need to lean into the fact that, like, especially if you're an audiologist, like, lean into that. You have a real strong point of differentiation right there. But I think that speaks to kind of like this status quo of like, well, for a long time, there's only been one way in which you can get hearing aids. It's through your hearing healthcare professional and your dispensing professional. And so now it's like, as that sort of gets reduced, it's like now is where the rubber meets the road, where I think that this is like, we're going to have to figure out ways to kind of repackage that value. And I think that it is very much tied to this whole idea of like you said, like treating the patient holistically. And that is just really exciting for a number of different reasons.
Mhm. Absolutely. Yeah. Those physicians are what's going to get us through this, you know. They're the ones the patients ask their doctor, what do I need? Well, you need to go see Dr. Davis and we'll take it from there. So mhm.
Absolutely. Well, Jill, thank you so much for coming on, sharing your thoughts about what's on the top of your mind and how things are changing. I really appreciate you being part of episode 100 and for helping me out with the podcast to get to this point. So thank you.
Of course. Thanks for having me. Congratulations again.
Take care.